My entire life, I've had lots of cats, dogs, and actually a few other weird animals. Now, as a pet owner, have you ever had that situation you had to take your pet to an emergency vet clinic? Now, I've done it a few times, and if you haven't, unfortunately, I can promise it's not a matter of if, it's a matter of when. So in today's episode, Dr. Garret Pachtinger, he joins me, and amongst many endeavors, he's a board-certified emergency and critical care specialist for over 15 years. And with his years of experience, he understands the chaos, the uncertainty, and the emotional intensity of critical cases. And as I'm sure you know, when something happens to your pet, it's emotional, and it's really extremely stressful, especially since they can't talk to us. And also, our stress stresses them out. So Garret goes into ways to evaluate if you really need to bring your pet into an emergency. He goes into several things we can do to prepare for a possible emergency. Now, steps that we can do when we're bringing them in, and so much more. And one of the big things, at least for me, he walks us through what exactly is going on behind that door when they take our pets back into that really scary back room. You've probably had this happen. You're waiting to get seen, human or animal, and the staff lets someone go ahead of you. Now, we talk about that, and he breaks down what's exactly happening. Now, I really wanted to do this episode. I wanted to break down so I could better understand the process. So with Garret's experience in chaotic situations, I promise, after this episode, that chaos, it's going to be replaced with just a little calmness.
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange, losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Hey everybody, and welcome back to the For Real podcast. Today's an episode I really wanted to be doing for all the pet owners out there, and it's a really good one. Please welcome Dr. Garret Pachtinger. Garret, welcome to the show.
Hey Mark, thanks so much for having me. Excited to be here.
So you do a lot of things, which is, we're going to get into all that. And one of the areas that we're going to focus on is emergency vet care. But I want to talk about you first. Let's talk about your journey, how you got there, and then we'll go down the path however you want to go. So
awesome. Love it.
Cool.
So like most of us, I went to high school and then I went to Muhlenberg College in Allentown, Pennsylvania. Loved my experience there. Small school, was a science major, Spanish minor, which has helped me along the way, a little bit of Spanish. And I also played college baseball, which I had a really fun time doing. And then fortunately was admitted to the University of Pennsylvania School of Veterinary Medicine, where I attended my 4 years of veterinary school.
Did you know right away you wanted to be a vet?
That's a great question. The answer is no. I always knew that I wanted to be in science, in medicine. I loved, if you ask me what my favorite subjects were back in grade school and, middle and high school, science and math were what I gravitated to. I can't point to, if you ask me where a state is located on the map, forgive me. I don't know where all that geography stuff is. To me, science and math is the way I gravitated. And so what I did to figure out what I wanted to do within science or math is I just started around early teens to think about what professions were out there. I was fortunate that my mom was a dental hygienist, and so I got to see the human dentistry scene from the science and medical side. My grandfather was an optometrist, so I was able to see him practice and what that entailed. I did externships with physicians in a hospital. And then ultimately, I did a great externship, which turned out to be an assistant job as I was going through high school at a veterinary hospital. It was the Animal Medical Center of New City with Dr. Howard Gittleman, who is one of my mentors, and still chat with him here and then. And it's where I fell in love with veterinary medicine. I realized I could do what I wanted to do with medicine and science and math, and my love for that with pets that I also loved. And so that's when it clicked for me, probably around 15 or 16. Once I was able to work with Dr. Gittleman and see what he did, it just clicked. And that's when I knew I wanted to become a veterinarian. Now, funny enough, if you ask my wife, who Mark and I were talking as a veterinary ophthalmologist, she'll tell you from the time she probably could stand and walk that her parents told her she wanted to be a veterinarian. She has photos of her putting Band-Aids all over her little poodle dog at like 4 years of age. And so
that's cool.
A lot of people have that. I wasn't one that was born knowing veterinary medicine was it, but along the way, I just really fell in love with it. And that's where I went.
Wow. I wish I knew what I wanted to do now. I mean, I'm not that guy. I'm always impressed. It's funny when I talk to veterinarians in particular, most of them have known it pretty early on, and 15 or 16 is early on too, by the way, in my opinion. But most people know, and it's funny, like your wife who knew it right away. It's just part of the thing. It just is what it is. It's cool.
This, I think there's just a gravity towards it. There's a real calling towards it. It's not that I have this specific, my gut feeling is it's kind of like a pediatrician in a sense. You have patients that can't talk back, can't really tell you what's wrong as much. And it's fun. It's exciting. It's an adventure. Every day is different. Have to learn about a ton of different animals, species, diseases. It's a challenge. And that's what I love about it day in and day out, is that no day is the same from the day before or tomorrow. And I get to do something cool, fun, and exciting each and every day. And hopefully that involves helping a pet and a pet parent along the way.
So you go to vet school. At what point did you do a regular practice first before you went to emergency vet?
Great question. And for those that don't know, a little bit different than medical school. So after your 4 years of undergrad, you go to 4 years of veterinary school. And during your last year, your senior year of veterinary school, you take your national boards, which is daunting because you have to know everything. Even if you want to be a small animal veterinarian, there's questions on this exam about a horse, a goat, a bird, a ferret,
chicken.
It doesn't matter, everything. And so you have to know everything. Thankfully, I think most schools prepare you really well. But after those 4 years, and if you pass your national boards, which most people do, you can go out and become a fantastic general practitioner. No additional training is needed. My path was a little bit different. So while I was going through veterinary school, I fell in love with emergency medicine. I had some fantastic mentors. And I was also fortunate that at the University of Pennsylvania in Philadelphia, they had such a robust and amazing emergency room that I just fell in love with the professors, the instructors, the specialists that were teaching those courses, and just decided that is my calling. So knowing that I wanted to be a great emergency clinician, great intensive care clinician, I certainly could have gone out and become an emergency practitioner after my 4 years of veterinary school, but I had that sort of desire to do a little bit more. And so what a little bit more is a residency, but you can't do a residency in most cases right away. And so what I did after my 4 years of veterinary school is I did a rotating internship. And most rotating internships are called small animal medicine and surgery. So what usually happens in those internships is every 2 to 4 weeks, you switch. And so I was on the surgical rotation for 2 to 4 weeks with the mentors and specialists. And then I would do 2 or 4 weeks with internal medicine and 2 or 4 weeks with emergency. And so throughout the year, you really get a great idea of what all of these specialties and services entail, which is a fantastic opportunity. My personal mentor wanted to be a pathologist until she did her internship. Wow. And fell in love with emergency medicine. And so I think there is a really big distinction of what you think it's like as a student sitting in a chair watching a PowerPoint, very different from what it's like on the clinic floor, seeing those cases, dealing with the families, thinking about how to work things up. So that internship really gives you a great opportunity to dive in a little bit more and discover, is that truly your passion or not? And mine stayed true. So I did my 1 year rotating internship. And then after that 1 year rotating internship, I did a 1 year fellowship in emergency and critical care to really cement my desire in doing it. And then thankfully was accepted to a 3 year residency to become a board certified specialist in emergency and critical care. The residency, though, it's tough and grueling, but after that residency, I had to take a all day long examination and thankfully passed to become truly board certified. So fortunately, University of Pennsylvania was an amazing experience for me. All in total, I did about 10 years there, my 4 years of vet school, internship 1 year, fellowship 1 year, and 3 year residency, thankfully passing my boards and becoming a board certified specialist in emergency and intensive care, which is truly my calling and what I enjoy doing each and every day.
I can see where it'd be really rewarding because it changes all the time. But I'm just sitting there thinking, you like chaos. Basically, chaos would be the
I love chaos. Organized chaos is where I thrive. I think
yeah.
that's where my brain is the happiest, is having something happen to my right and to my left, in front of me, behind me, listening all around me. And so just being in that organized chaos. But I will tell you one thing I tell people all the time when they ask me about why I am a specialist in emergency medicine is that I wanted that extra level and layer of knowledge, but I truly enjoy being somebody that can be counted on, that can save lives that maybe others can't with the level of knowledge and experience that I have. And the other thing that allows me to do, and we'll talk about this, I'm sure, a little bit more, is usually within the veterinary profession, the specialists become the educators. And one thing I truly enjoy doing, which has directed my career in many ways, is being an educator, teaching other professionals based on my experience and what I know and learn about better ways to practice. Because while I can, for example, touch a patient and affect or direct that life, being able to educate gives me a multiple, because if I can teach others to do the same, then I can affect the profession in a much greater way, helping them improve their level of care and help those pet owners and those pets along the way as well.
So I got a question for if I go to an emergency pet center, do most of them have 10 years of education generally? How's that work?
Interesting question, and the answer differs. Most times, if you go to what's called a specialty hospital,
right,
and there are many of them around, usually a specialty hospital has specialists.
Right.
The question then should come after that is, are the specialists there 24/7? Usually the answer to that is no, the specialists are not there 24/7. So as an example of when I was in practice near me, I would have a shift, for example, that would be about 7 a.m. to 4 or 5 p.m. in the afternoon. There would be other specialists that would come on after me in the emergency room, but the one shift that usually at this day and age is not covered by a specialist is the overnight shift, because it has to be a 24/7 facility in most of these cases.
Right.
With that said, when I was on that morning shift as the specialist in the ER and the intensive care unit, I was also on call to support those doctors that were there when I or a colleague of mine that was a specialist wasn't. But many of these ER doctors, if not most of these ER doctors, are super well trained. I take my pets to those places as well and have full confidence they do a great job as well. They have support, they have education, and they have often guidance by specialists like myself, even when they're not there, for an on-call support. But not every hospital does have that. There are many great veterinary emergency rooms that are staffed by fantastic emergency room doctors that are not technically specialists.
Yeah, I was just thinking because, if you're a pet owner at some point or another, you've probably been an emergency vet. And I never really thought the process through of thinking at their education level. I was just thinking they were just like a regular vet, but most likely, maybe the ones at nighttime are, but if they've got a specialist call, they can do that. Because I'm thinking about the last time I had to go to one it was late at night. My dog it was a rescue that was breathing bad, had really bad infection that the rescue didn't pay attention to it. So we had to put him in oxygen and a bunch of different other things too. So let's talk about emergency vet. So you're now after your 10 years, you're practicing that. So for people out there that are listening, walk them through. One is how it works, because everybody's freaking out. I mean, how do you calm a pet parent down to understand how the process works, and how can it be better for me if I'm bringing my pet? I've got like 100 questions, by the way. This is like a multi question, but for me as a pet owner, what can I do to make sure the process goes better, and the whole thing? Just I could keep going, but I'll pass it on to you. You know what I'm trying to do.
I love it. No, I absolutely love it. And, I think the first step when you're a pet parent is to try to be prepared. And we hear this all the time with human things that happen, whether it's a flood or a tornado, a hurricane, whatever it may be. And they always talk when that's coming up to be prepared. Make sure you have a list of all your medications that your pet is on, because that's really very important when we ask you those historical questions to know what has happened in the past. If medical records are together, great. Have a list of the medications. And then ultimately, I would love for you to know where the closest emergency room is, because the last thing that you want to be doing when something truly happens is to not know and to be Googling in the middle of the night or trying to call your vet, then they give you the answering machine and you just don't know. And so being prepared is often the first step. And I say this on the veterinary side as well when I'm training other veterinarians about emergency situations, is that often the stress during an emergency situation is not knowing what you should do. It's just not knowing where things are, not knowing where, and that raises the stress level so much, both for professionals and pet parents. So try, number one, to be prepared. Have things together, have a medication list. If you have your medical records, great, and then know where that location is. I know this always isn't possible, but if you can call on the way and let them know, that gives us an opportunity to also prepare. So if you say your dog is coming in, like Mark, you just said, with breathing problems, we'll get that oxygen cage going and make sure the oxygen level in the cage is elevated so we can make them breathe better as soon as possible. If it's a patient that is bleeding, we'll get things together to improve that situation. So if you can call, great. Now, certainly do not put yourself in a dangerous situation trying to drive and call and worry about your dog. But again, if you can do those things, fantastic. Otherwise, ERs are ready for you to be there, regardless if you call or not. Where you go will dictate a little bit on what the process is. But one thing I will say at the start is that we recognize, I promise you, we recognize that you wouldn't be there unless you are stressed and worried. Nobody wants to come to the ER with their loved one, with their pet at 2 o'clock in the morning unless you need to be there. But there are priorities in different situations. And the other thing that I tell people is you also don't want to be the first pet rushed back, because people get stressed. Why am I still sitting in the waiting room? Why hasn't somebody come out to see me? I promise you, we are not ignoring you. It's actually a good thing in most cases if we don't immediately rush your pet back into the treatment area, is because something is back there that is making us more concerned than your pet, which I promise you in an emergency room situation is a good thing. But there are some hospitals that will take your pet back for evaluation and to determine the severity, because sometimes we can see something that you can't. There are some hospitals, some ERs now as well, that will bring you and your pet back together with them, and they don't really have a waiting room. So it's just a different in function on how certain hospitals work. But usually when you come to the ER in some form or fashion, the first thing, aside from telling the front desk that you're here and giving them some information to check you in, is your pet will get what's called a triage examination. In triage, the word triage is actually a French word, and by definition, it means to sort. And it's a old military-like term, not to be gruesome or sad in any way, but certainly in the military world, they have to figure out if somebody is savable or not, and where to use those limited resources. And so way back in the day, they would determine, can we try to save you, or are you too far gone and therefore we're not going to waste our supplies and resources on you? Now, that is not the mentality anymore, certainly with what we're talking about here. The point is, we're going to triage your pet, which means do a very rapid emergency room-like assessment to determine how sick your pet is. For example, we worry about the major life-threatening body organs first. Is your heart working properly? Are your lungs working properly? Is your brain working properly? To put it in perspective, if your dog's limping, rarely, if ever, is that a life-threatening emergency. We know that's a problem. We certainly want to assess. We certainly want to make your pet and you feel better. But maybe somebody that comes in that can't breathe in respiratory distress, or their heart's not working and they're in heart failure, needs to be seen first, because they are life-threatening in illness, where your dog certainly is in pain, or cat, or whatever pet you have, but can take some time for us to save a life before we have to deal with that also emergency room situation. And so the triage exam is one that we look at the major vital signs, the major vital organs first, and then later, once we determine if your family member, your pet, is or is not stable, we'll do a more thorough examination. Things that are not life-threatening, the lymph nodes, the gums, the tongue, the legs, joints, things like that of course we need to make sure are functioning and working well, and not while you're in the ER, but not life-threatening. And so we will do a triage exam first. Now, sometimes after the triage exam, we say, your pet is stable, why don't you have a seat in the waiting room and we'll get to you absolutely as soon as we can. Or sometimes we say, you know what, based on our exam, we think that your pet should be back here with us so we can keep a very, very close eye on them and make sure intervention, treatment, therapy, Mark, like you're talking about, oxygen, isn't needed, at least until we can figure some more things out. And so the first step is you check in and a triage exam is performed. Following that, usually a thorough history is taken. So myself, one of my nurses, will come in the room and try to get a pertinent history from you to find out if anything is important. And you would be surprised about how many times the history is the clue of the puzzle that tells us what's going on. Mark and I were talking about earlier, there's not many things that match up to veterinary medicine. I feel like a pediatrician on the human side is like them. Our patients can't tell us what's wrong usually. They don't point to it. They don't talk to us. They don't tell us on a severity scale of 1 to 10. So it's our job to use our exam, but also that history is so very helpful to determine if there's a clue or link to what's going on. Everything from longevity to suddenness to all of the medications that your pet may or may not be on, to everything from, does your pet normally live with me in the Pennsylvania area, or did they come from the South or the West? Because they have different diseases, different toxins, different things that could make a lot of sense in the history. So we'll get a really, really good, thorough history. One other comment I'll make right away is that I always talk to pet owners, and I talk to professionals about this as well, is there are times when, of course, we want to get tests. But getting a test on a patient that is not stable and may cause more harm can actually be obviously detrimental. And so there are times we will purposely delay getting tests to start some form of life-saving therapy so we can try to get your pet more stable to get those tests. So a delay in tests isn't just because we're busy or we're working on or prioritizing another family. It could be because we are doing everything in our power to get your pet more stable, so at the time we want to do tests, they're comfortable to get those done.
For real, 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 for real.
And we'll be right back.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
One of the things you brought up, because I know I don't have it, is having your pet's records. Should everybody, when they go to a vet, just get them to give you when you're leaving a copy of records just to have it with you, just in case something happens? How important is that for you guys from an emergency pet thing? I don't have it for sure. I know.
Yeah, it's a really, really great question. I don't know that a full medical record is often needed. For example, if you have a 1-year-old golden retriever that has been to the vet for vaccines and a checkup and is here today in the ER, they don't really likely have a good past medical history that's important that is going to be in a medical record. With that said, if you have a 14-year-old dog that has this disease and on that medication and has had surgery for this problem and that problem, technically I don't even need a full medical record, but I do know what happens in the scariness, in the excitement, and the anxiety of the moment is I'm sitting with you, Mark, in the exam room, I'm asking about your dog, and you're trying to remember and you just can't because you are stressed. You are nervous, you are upset, and things get lost or missed. And so even if you have a bullet point highlight list of the things that are pertinent to your history, I don't need the 42-page medical record. But if you tell me my dog was diagnosed with this, he's been on this medication since this date, he's had this surgery, that makes sense. That's very, very helpful. But you don't have to have the full medical record. If you do, great. A lot of things are digital age. They can be emailed just for you to have on file. But at the same time, at minimum, I'd love a bullet point pertinent medical history. And of course, again, like I said earlier, a medication list is very important because just like in people, there are some medications which have contraindications, meaning this and that should never be given together. And if I don't know that, or you say no medications because you're stressed, you're worried, you're upset, that can be a problem with me starting another medication. The other thing that I'll comment on is I actually changed my personal style of how I ask this question to pet owners. 25 years ago, it was very obvious. Now, there are a lot of over-the-counter, homeopathic, nutraceutical-like things, and I have had many experiences where because it wasn't prescribed, the family doesn't tell me. So now I ask the question in a different way. I don't ask pet owners what medications are your pet on. I ask, what are you putting in your pet's mouth? Anything prescription, over-the-counter, homeopathic, nutraceutical, what do you put in your pet's mouth? Because you'd be surprised what comes out when I ask it that way versus what medications is your pet on. Sometimes I don't hear a supplement that has something like salicylic acid, which is aspirin, which could be detrimental and contraindicated if I give something else. You'd be shocked, or maybe not, about all the things that change when you just reformat or rephrase that question because of all the new things that we are able to give and get that are not prescription.
It seems to me it would be an easy thing from back to your records. Every time you go into the vet, get one, and then just give me an update on that. So I've got a file at home. I've never even thought about it, but it's kind of, especially if you're traveling too, and you got your pet with you too, if something happens too. I know you can get it during the daytime if you call the vet, but if you have it with you or you even put it on a digital file, it makes a lot of sense, just from a simplicity standpoint for everybody.
You make a good point because you mentioned the word or phrase travel. And just like I talked about earlier, if you're bringing your pet with you and you're traveling, I advise you where you are going, where you are ending up. Look up where the local ER is because that's even more stressful. You're not near home. You don't have the familiarity. Even if there's an ER here and here and here and you don't know where you're going to, you know where the three of them are near your hometown, near where you live. But if you're traveling even more, research. Find the local ER for where you're staying, or if it's a long car ride, find a couple along the route just in case, so you're not stressed if something happens while you're en route or when you get there.
So I've got a question, and I know that I know the answer has to be careful, but I know that I guarantee you people freak out and the dog doesn't need to come in for emergency. When you mentioned earlier the dog limping, that doesn't sound like an emergency unless they were hit by a car or something, because there'd be internal injuries and that. How do you differentiate what's an emergency or not? Again, I know that it's kind of a bad question because if you know, you know, but what are the ones where you get and you go, this dog or cat doesn't need to be in here? I know I know the point. So you got to be real careful what you say.
I love the question. And the first thing I will say is we don't know.
Yeah.
And I think a lot of times we don't know. When I say we, pet owners, they're not trained, and nor do I expect you to be trained to know if it truly is an emergency. And so with that said, if you have an inkling of concern, call the ER. And typically a nurse or doctor will get on the phone, ask you a few questions, and help you decide if it's an emergency or not.
Right.
So if you're worried, that's what we're here for. We went to a lot of school. We love what we do, and we're happy to help. And so call. And it's possible they may say, based on everything you said, you have a 2-year-old happy and healthy Labrador Retriever that roughhoused and ran in the yard, is limping a little bit, but as you tell them the story, you're saying my dog is eating and drinking and happy and wagging and is just limping a little bit, but there's no other changes. They may say, listen, you're welcome to come in. Currently, because it's 11 p.m. at night, it's a 4-hour wait, just letting you know so you're not upset when you get here. But if that's all that's going on, you certainly have the option as well to call your primary care, your family veterinarian tomorrow morning and see if they can get you in. Or if they can't, maybe there'll be less of a wait in the morning. You're welcome to come in at any time. It's very, very rare that an ER is going to tell you, we refuse to see you. Very rare.
Well, of course.
And if they do, usually what they do is they will document the examination. So I've had cases, many, where pet owners brought their pet in to me in the ER. I've examined them and said, listen, I know you're here. I know you're worried. What I can tell you is your dog is super stable, and I'm happy to see you. But again, it's like a 4-hour wait. I'm also happy for you to go home. I'm not going to charge you for the exam. Go see your family vet in the morning. And often you'd be surprised, or maybe not, how happy they are that I took a look. I had a conversation with them.
Right.
Somebody told them with
affirmation,
some authority or credential that it's okay. And if something changes, please come back in. But we're here if you need. So I think the first thing is to not feel alone in this situation. You're certainly welcome to call. And more often than not, they'll get on the phone with you, ask you a few questions, and determine if something truly could be going on or not. Limping, yeah, that's one of the ones that may or may not be a problem. And Mark, I can give you an example of how it depends, right? So in my case of my Labrador Retriever that is 1 or 2 years old, that just roughhoused and now is a back leg limp a little bit, eating, drinking, happy, playful, wagging, loves you, jumping on you, probably doesn't need to be come in. But now if you told me, Mark, let's change it. Now we're not a 1-year-old Labrador. Now we're a 7-year-old Dachshund that is limping on one or both back legs. Now, you may perceive it as a pet owner to be limping, where in my brain as an emergency room specialist is saying, certainly could be a limp, but Dachshunds are a known breed to have a slipped disc in their back in lay terms, which can result in a spinal cord problem, even paralysis. So that may be a very, very different case, and me asking you questions and not just assuming it's a limp. What is your dog's breed? What is your dog's age? What is your dog's history? Now, just on that alone, which in medical terms is almost called what we say a signalment, is my thought process is totally different now. Now I'm not thinking, oh, probably just, a little strain or sprain. Now I'm thinking we should make sure this is not the onset of a spinal cord compression that can lead to paralysis. You should come in. And so there's lots of things that as doctors we think about much more than just, in quotes, a dog that's limping or a dog that's vomiting. Give you another example. If you said to me, Mark, I have a 1-year-old lab who got he counter surfed, as we jokingly say, and ate 3 slices of pizza, and now he has a little bit of vomiting and diarrhea. Okay, that's a very different story than if you said, I have a 1-year-old lab that looks like he has a big belly and he's trying to vomit and nothing's coming out, or he's vomiting and sometimes they say just white foam. Now I'm not thinking what we call dietary indiscretion. He ate pizza when he shouldn't. Now I am thinking, oh boy, this could be a lab that has what's called bloat. In medical terms, it's a volvulus and dilatation, meaning his stomach is twisted, and this is a life-threatening surgical emergency. And so my point being, a lot goes into this, including asking questions, understanding the age and the breed and the history, and why, if you're a pet owner that's not sure, it's absolutely very acceptable and encouraged to call to find out, because as professionals, we may think very differently based on our training to help you understand if it truly is or is not an emergency.
So what I'm taking from so far is I probably should have a copy of my records because it's a simple thing to do. 2 is if I'm not quite sure if it's an emergency, I make the phone call. If it's an emergency, just go and you can call them away or whatever you're doing. Those are the 2 big things. So walk me through. I'm a pet owner and I'm freaking out. And walk for people that are out there that panic and that. Tell them your guys. I know we've walked through this a little bit, but tell them to ease the anxiety. They get there. Why they know now it's in good hands. Walk them through a little bit of your process and say, okay, I know how this is going to work. You're going to be fine. Just chill out. Because you know what? If I'm freaking out, the animal's freaking out because it reads me. So that's another thing I think people have to be aware of as well.
It's understandable. I mean, they are your loved one. They're your pet. And when they're not feeling well, and even more so, like a baby, like a toddler or child, they can't tell you what's wrong. And so we have to feel that and be that for them. And so you're their advocate, and it's totally understandable that you are upset, that you are anxious, that you are nervous. And we recognize that as veterinarians and emergency practitioners, that we expect you to be that way. It's okay. And we're there to make it better. I tell families all the time, I'll get my triage exam, my history, talk to them. And more often than not, when a case is referred to me or comes in the ER, I don't have the answer the minute they walk in, especially when they get referred, because their amazing family practitioner has probably started the workup and said, listen, I started the testing, I did some blood work, I did some x-rays, and I'm not seeing anything obvious yet. I think you need the facility of an emergency hospital, of a specialty hospital that has more equipment, maybe 24-hour care. And so one thing that I always tell pet parents is, I don't have the answer yet. What I do have is a plan. And that's what we're here for, is we're here to use our judgment, our guidance, our education, our experience to help get answers for you in a logical and safe manner. And so that's what we're going to do. And we are going to update you as often as we can along the way with test results as we get them and a plan. But it's okay. We do understand that you are stressed, you are anxious, you are nervous. Whether it is a wound on their side, which is probably not life-threatening, or a heart problem or a lung problem, which could be life-threatening, you're going to be upset and anxious. Like I said at the start of this podcast, that you wouldn't be here in the ER at 2 o'clock in the morning unless you were, regardless of the issue. And so it's okay. With that said, I also want you to recognize that we as professionals are here for you, and we're going to do everything we can to make it better, to get down to the bottom of it, to get you answers in a timely manner. We're going to update you along the way, medically, examination-wise, financially, okay? And so recognize that we are trying our hardest. What I do also talk to pet parents about, like I mentioned with the delay of test results for the safety of the patient, is that in my head as well, things happen faster than they can in real life. I jokingly will say, I bark orders at my nurses. I want a catheter. I want blood work. I want x-rays. I want ultrasound. In my head, that's a 30-second proposition. I know that's not the case. And so things take time. We want to make sure they're safe. We want to make sure that they are protected. They're getting the therapy they need. And then once that happens, the test results. And sometimes test results take 3 to 7 minutes. And sometimes test results take hours or days to get back. We recognize you want them. I promise you, maybe it's almost as much as you want them, we want them as well, so we can get down to the bottom of it and give you more information to help tailor that treatment plan and help make your pet better.
So do you have any cases that stick out to you remember for people to hear that were really good stories?
I have some great cases. I've been in the ER in West Philadelphia at the University of Pennsylvania, in the ER in the suburbs of Pennsylvania in Bucks County, and boy, have I seen some great cases over the years. Admittedly, some of them had fantastic outcomes, and some of them had some sad outcomes. Often in the intensive care unit world, which we're focusing a little bit more on the ER side of things now, but people are often surprised in the intensive care units in which I've worked. It looks like a human intensive care unit. We have the same bells and whistles, the breathing machines, the dialysis machines, and often if you end up in the ICU in the veterinary world, it's the same thing as in the human world, and that it has to be, unfortunately, a pretty sick patient. And so often in those cases, the prognosis can be a little bit more challenging. In the ER, you get to see a lot of other different things. And some of my most fun cases have been toxicity cases. Pets that got into certain toxins, because you can identify them often quickly and make differences often quickly. And the fun thing for me is time is of the essence in those cases as well. So it really puts my level of education and my expertise and my fortitude to the test, because I have to get to it right away. Some of the toxins have changed quite a bit over the years. I can tell you now, and it's probably not surprising, and thankfully usually nowhere near fatal, but marijuana, THC toxicity, is a super common toxin we see. But I was diagnosing this back in the early 2000s, well before things became legal or recreational or medicinal, that it became much more functional, when pets would come in and they would appear neurologic. And you think, oh my goodness, they have a brain problem, they're stumbling, they're ataxic, which means they're kind of wobbly when they walk. And you're like, oh my God, could this dog have a brain tumor or have gotten into another? And you look at them and they have a very classic set of problems. Often these dogs, because it's usually more dogs than cats in the small animal world that get into marijuana, THC, their eyes, their pupils are very dilated. Their heart rate is on the lower side. They're stumbly when they walk. And they dribble urine. Kind of as they walk, they kind of drop urine all over. They're peeing. happens. And so you take a look at that dog, you say, okay, I see what's going on here. And just like in people, you can go to the drugstore and get that urine test where you dip those colored sticks in the urine, and they can tell me, did this dog get into marijuana? And thankfully, more often than not, and it's become thankfully even more common now, pet owners are usually very forthcoming because it's not something we care about. I will tell this to pet owners, we don't care. It's rare, if ever, we're going to report you. As a joke, I know you didn't want your dog to get into your stash. You paid a lot of money for that. You didn't do that on purpose.
Right.
Silly dog got into all your flower, your marijuana, whatever it is. I just need to know so I don't have to say, well, if it's not marijuana, it's a brain tumor or another blood problem. I can make this super easy and tell you your dog is going to be fine. So I dip those sticks in the urine and comes back. And usually when you go into the room and talk to them, say, hey, any chance that they're like, oh yeah, absolutely. Yeah, totally got into my stash. And so those are fun. Another really fun one that I enjoy is there are certain dewormer toxicities that dogs get into. And one of them is an ivermectin-like toxicity, which is really popular for people that have both dogs and horses that often get dewormed with that. These dogs can come in looking almost comatose or even dead. That's how serious this toxin can be. And thankfully, extrapolated from human medicine, we can give them what's called a lipid therapy, which basically you give them a bag of fluids, intravenous fluids, that when you look at the bag, it's a white liquid because it's essentially lipid being fat.
Right.
And that fat sucks the toxin out of the organs and bloodstream and keeps it there. And so within minutes to hours, a dog that looks almost dead for what it's worth is totally normal. I've had several cases of that where the owner didn't know what was going on, and I guessed, in a sense, when I say guessed, medically guessed, and made sure that was the case. And before you know it, that dog was standing up in the cage and wagging, and nobody could believe it. So some toxins are really fun and exciting. Some toxins are not so terribly fun or exciting that don't have antidotes, reversals, can't really mitigate it very well. Certain toxins that I talk to pet parents about all the time that we should know about. Grapes and raisins for dogs are ones that we should absolutely avoid. Currants as well, which is in the same family as a grape or raisin. You have some older pet owners that would talk about how as treats as kids, they would give their dogs grapes or raisins as a fruit, thinking it's healthy. But there's a response now that we're seeing in dogs over the past 5-10 years where grapes and raisins cause irreversible kidney failure. They will die from this. There's no reversal, and it's sad. Other things that are common in our over-the-counter kitchens, etc. I think most people recognize that chocolate is not a good thing for our pets. Onions, garlic can also be toxic. One of the newer things that's not as new anymore as it once was is the chemical or substance called xylitol. Xylitol is a sugar substitute. So when we think of our sugar-free gum, for example, some of them have sucralose or other sugar substitutes. But xylitol has become something that a lot of baked goods, sugar-free baked goods, or certain gums have in them as a sweetener. I've had cases where sadly a dog has gotten into a cake that was baked with xylitol. And two things happen with that toxin. One is that it causes a very, very low blood sugar, because in English lay terms, what that substance does is it makes the body think there's a lot of sugar in the system. Now, it's a sugar substitute, not really sugar, but when your body thinks, oh boy, I just had a large sugary meal, the pancreas releases insulin to push that sugar away into the cells. And so in this case with the xylitol, it's not really sugar. And what it's doing is it's faking the body out. And the body says, oh my God, I have all this sugar in the system. I'm going to release all of this insulin. And then the patient has a life-threatening low blood sugar, which what you see as a pet parent is they look weak, lethargic, wobbly, and then eventually their brain doesn't have enough sugar. They can have a coma or even seizure. The other thing that is not truly understand, the big fancy medical term is called idiosyncratic. Idiosyncratic means we don't understand why this happens. Again, the insulin and low blood sugar, I just explained we recognize why, but the idiosyncratic unknown why part is it causes liver failure, causes toxic liver failure. And so I've had dogs that unfortunately have started with low blood sugar and have been fine. And I've sadly had some dogs that have gone into liver failure and sadly have not been fine. So those are some sad toxins that they can get into that I think we have on our shelves, in our kitchens. The other one that I'll comment on, and then I'll pass it back to you, Mark, is a plant that we often have in the house, and that's certain type of lily plants. And it's not every lily plant that is toxic, but several like Easter lilies, which around Easter time become very, very popular. Even the pollen on a leaf from a lily plant can cause irreversible, deadly kidney damage for cats. And so you have to be very careful, especially for cats, that you have plants in the house to research before you bring that in to make sure it is or is not toxic. There are many plants that are not. There are also many plants that are toxic, but locally toxic. For example, some plants and even some different lily style like plants have what's called calcium oxalate crystals in them. And so it makes the cats, when they eat them, it irritates their tongue and they drool and can get ulcerations on their tongue, but it's not life-threatening. It's annoying. It's frustrating. It's problematic. But if you have pets in your house, cats, dogs, or otherwise, make sure the plants you bring in, for example, are safe and certainly not remotely limited in their toxicity like their mouth, but certainly not like a lily, an Easter lily, which can be deadly for cats.
Poinsettias are poisonous too. Do you have problems with that as well?
Absolutely. And, I think the nice thing is, we always joke as professionals, Dr. Google and what did you do before you came in? But I do think the availability of information, double-edged sword, is helpful in many cases because pet owners have a much easier time finding reputable websites or locations where they can determine. And so, fortunately, some of these toxicities have become far and few between because we're not seeing them. Veterinary professionals have become much better about educating pet parents, and pet parents have a great opportunity to also educate themselves, ensuring what they're bringing into the house or around the house is or are not toxic. But yeah, Mark, absolutely. Poinsettias are one of them as well that can lead to toxicity.
So I know you do a lot of other things. I mean, I want to move on to your Tether project you're doing, but I don't want to leave anything out. Have we left anything else out if we're talking about emergency vet medicine for anybody that we didn't cover that we want to get to, and then I want to talk about Tether?
I'll leave one final note about veterinary medicine in general, but I think this obviously is very pertinent in emergency medicine. I am a huge proponent of pet insurance, and it is not, how do I put this? I think it's very well known that in the past 5, 10, 15, if not 20 years, this entire world, everything has become more expensive, let alone veterinary medicine, as medicine has become more expensive. Now, I'm not here to debate the if, ands, buts, or whys. I would certainly tell you that as compared to 5, 10, 15, 20 years ago, what we're able to do as professionals is so much, it's remarkable. It is. The toys, the tools, CT, MRI, ultrasound, blood work on the spot, point of care. I mean, it's crazy. But sadly, with that comes a price tag for us to keep the lights on to be able to provide those services. And so if right now, if you're listening to this podcast and you have a cat or a dog or another pet, right now, if you tell me, Garrett, I have $10,000 sitting in the bank, and that's my number that I would tell you. I have $10,000 sitting right now that it's disposable that I could use in an emergency. I'd leave it up to you whether you wanted insurance. I joke with my iPhone sitting next to me. My insurance is an absolute waste of money that I get charged for every month until I drop my phone and break it, and then it's the best thing I ever had. Same thing with pet insurance. If you can tell me you have $10,000 that you put aside that is your rainy day fund for an emergency for your pet, so be it. You can do what you want. If you tell me that is not possible, I absolutely implore you to look into pet insurance. And there are several ones out there. I'm not here to promote. I, as a veterinarian, have pet insurance on my cat and my dog because I can tell you stories of my dog and my cat that sadly both have passed away years ago, but I had emergencies with both. I had to take them actually one of them to a facility that was not one that I worked in New York City for a very special procedure. And that visit alone was a over $20,000 visit without pet insurance.
Pet insurance is important. I say it all the time, and I'm going to reiterate what you're saying. But most people don't realize with pet insurance, it's not like our medical insurance. It's really inexpensive. You can get it, and I tell people all the time, because as you know, I'm talking to pet owners and veterinarians all the time, and the stem cell thing I have is covered by pet insurance. But I always tell people, get it. It's not what you think. It's not like us getting our own insurance. It's a lot less money, and it's an easy one.
And I would also encourage people to get it early.
Yeah.
The reason that I tell you to get it early is you want it before your pet has pre-existing conditions. I have people that come into the ER that don't have pet insurance and their dog comes in with, let's say, a heart problem. And they say, great, I'm going to get pet insurance. And so next time I have to come in, it's covered. That's not going to be covered anymore by most insurances, if not all, because it is now a pre-existing condition. You can't get insurance for a disease that's already been diagnosed with almost all, if not all, pet insurance companies. And I recognize you may be saying, Garret, I don't need pet insurance on my 6-month-old puppy. I disagree. That 6-month-old puppy hopefully doesn't have an older age kidney problem or an older age heart problem. But what that 6-month-old puppy may do, more likely than an older dog, is wander off and get hit by a car or eat the sock and need a $5,000 foreign object surgery. And so at every level, they are at risk for something. Usually when you get pet insurance for a young, healthy pet, it's also less expensive. As they age, it may go up a little bit depending on your plan, but I promise you, you will thank me for that emergency that becomes that $5, $6, $8, $10,000 bill that you are covered and are going to get most of that money back. Like I said, that $20,000 visit that I had in New York City with my cat that had a kidney problem, after insurance was about a $1,800 visit.
Right.
Remarkable. So as a veterinarian, I'm not just saying it, I practice what I preach, and I would encourage all pet owners, again, if you can't fork over $10,000 to me right now, I encourage you to consider pet insurance, and even more so with a new pet, get it while they're young.
And we'll be right back.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
Let's talk about Tether, what it is. You're involved with that. Tell everybody how you're involved and what it does, because I think it's a really interesting story, and I like the concept.
I love it. And I'll start by this. In my entire life, I've tried to use technology to my advantage, and I truly feel like it has benefited me in many ways. And we are certainly in an AI era, a technology era, where things are getting faster, better, quicker, and even less expensive. I mean, a small joke aside here, I remember my first flat screen TV that I got. It was $5,000, weighed 200 pounds, it felt like. I think I slipped a disc trying to put it on the wall because that's what it was at the time. It was new technology.
Right.
Now you can go to your local electronics store and get a 65-inch TV for $175 that has amazing resolution. And the same thing applies for technology across the board, which is why in medicine, human, veterinary, etc., these tests, the availability with technology have gotten a lot better, faster, better, quicker, and even less expensive to run these tests as the years have gone on. And so recently, funny enough, I was chatting with a friend that I played Little League Baseball with 35, 40 years ago. And we were talking about things, about life. In fact, I connected with him on LinkedIn and we were just chatting. We said, hey, I have this friend that is creating this company called Tether. And what they're trying to do is create a collar device starting out for dogs with the goal of recognizing problems, as simply as I can say it, recognizing problems before they are truly recognizable. Now, I'm making it simple, paraphrasing a little bit. But the point is getting more information earlier to help us understand what's going on. Because, Mark, I can give you many stories, but think about it this way, and I'm sure most pet owners, including myself, and certainly on the veterinarian side, we've dealt with this. Something's wrong, right? We know our pets, and I tell this to pet parents all the time. I trust you. I believe you. You are around your dog essentially 24/7. I'm around your dog 15, 20 minutes. So if you're going to come here and tell me something is wrong with your dog, I'm going to believe you. But the problem is you've been watching your dog for 3 days. They're eating a little bit less. They're not standing up as quickly. They're restless. They're whatever it may be. The problem is you put your dog in the car. They're excited. You get to the vet office. There are other dogs there. There are new sights. There are new smells. There are new sounds. I bring you and your dog into the examination room and they're excited. They're wagging, they're licking, they're running around. And I'm going, wait, hold on, Mark. You brought your dog in because he or she is lethargic, which means they're kind of like sleepy. They're not are you kidding? Now, I'm joking with you because I just told you I believe you. That's the problem, though. In a lot of these cases, I believe you something is wrong. But we don't have that longitudinal data to say, okay, I can see over X period of time, things have changed. I know you can't see me on this podcast now, but I'm wearing one of my fitness devices on my wrist right now, and I look at it every day because what it does is it gives me longitudinal data. It tells me not only how I slept last night, but how I slept over the past week and the past month. It'll tell me what my body temperature is, not only today, but what it's been over the past week or month, and the list goes on. And so what Tether is doing is it's creating what's called the rough collar. It's a device that you attach to your dog's collar. It's not something where you need to buy the collar itself. And it's testing and looking constantly at data. Now, importantly, it's not only saying, okay, Mark, we recognize that you have a 3-year-old poodle, and so it knows that 3-year-old poodles should have this heart rate, and 3-year-old poodles should have this body temperature. It does know that, but what it also is doing is it's saying, not only do we know what normal in general should be, but now we're focusing on your specific pet. It's saying your specific dog, this poodle, now we're saying after a period of time, it has had a body temperature of this over the past week, and over the past 3 days, it's climbed up a little bit. Could something be brewing? It's saying normally your dog runs around like this. Now we're noticing that the gait, which is how the legs move, is a little shorter than normal, or it's taking longer to rise off the floor, or the heart rate, which has consistently been this in this specific pet, not only normals in general, there's a variability. And so what it's going to allow us to do is get that longitudinal data. So we have understanding of what dogs or pets in general should be, but it's saying your dog is unique, and we should recognize the uniqueness of your pet and recognize when there's an altered state of your pet. So before something is worse, before it manifests as something greater, because many of our pets are great, cats even more than dogs, quite honestly, at hiding things. And I tell this to pet parents all the time. They do such a good job at hiding things that by the time something really rears its ugly head and manifests, it's moderate to severe. Because if they were in the wild and had those wild instincts and they acted sick in the wild, they'd become prey. They're not going to do that. They're going to hide it to the best of their ability until they are no longer able to compensate. Their breathing patterns, their heart rates, everything, they're going to compensate until they no longer can. So now having the ability to say something has changed over a period of time before it gets worse, it's not going to diagnose, to be very clear, and we're very upfront. And I would also say, Mark, because you asked what my role is, I'm an advisory board member. It is not my company, but because I feel so strongly about what they're doing, I wanted to help them and support them as a professional understand what we should be looking at. So I'm simply an advisor and very happy and passionate about what they're doing. But this is going to give us as professionals a way to get data that can't be obtained in any other way. So when I look at the pet, I have my exam. But even if, again, Mark, when you bring your dog in, he or she is much more active than I would have expected based on what you told me, I can look at this data and say, not only did I believe you, Mark, but now I have objective information to say what the heart rate has been. I can say what the temperature has been. Yeah, I see the temperature's up a half a degree or a degree over the past week. Let's run blood work. Let's check the white blood cell count. Or the gait is off. We're not walking as well. Let me maybe I should do a better exam on the legs. Even if they look good here, the adrenaline is up, they're not limping anymore, and they're compensating. On exam, I'm trained enough to say if there's pain, I'm going to find it. So the ability to have this information, you as a pet owner will have it, and the ability to share that with your pet professional, your veterinarian, the ER, etc., is going to be foundational to help us truly better understand what we're doing the moment you walk in the door.
That's cool. Really cool. Anything else you want to talk about it? Because we're going to get to the joke thing here pretty shortly. What else have we left out? I know we've talked a little bit about AI and stuff, but let's just kind of set that aside and talk about that as we kind of close up.
Sure. And so what I would tell you as pet parents is obviously you need to have a great relationship with your veterinarian, and I'm sure they would encourage you to learn and know more. I know I did mention earlier that I think we're living in this fun and crazy age where technology is being used to our advantage, and there's a lot out there that as professionals, as well as pet owners, that we can find and search for. If you're not sure if your research on the internet is acceptable, correct, ask your professional. Okay, we're happy to help you. One thing that we would love to do, I do this all the time, is point you to reputable websites. Because the last thing I want you to do is Google something and then somebody on, we'll just jokingly say Reddit, tells you, oh yeah, I treated this cancer with 14 dandelions and 2 cups of coconut oil, and you to believe that to be true. I'm not saying it is or isn't. That's not my platform. What I am saying is that there are some things on the internet that certainly are not evidence-based, that are anecdotal at best. Anecdotal means experience-based. Now, I would argue, I'd like to think my anecdotal experience is different than somebody who doesn't have training. So talk to your professional. Find out where they find reputable information. And if you want more information about your pet's illness or disease or want to be more educated, I promise you, your veterinarian's going to love having you be part of that journey of treatment and for you to become more educated, because the more educated you are and understand, the easier our job is. So when I tell you, yes, we should repeat blood work every 6 weeks on this medication, you're going to say, yeah, that makes total sense, because I read that this medication can affect the liver and we need to make sure the liver is okay. And so we're happy to point you to reputable resources. And that goes for everything from Dr. Google to all the AI resources out there. And so if you're not terribly familiar with AI, just recognize that most of the public-facing AI sources are open, meaning that they can search anything and everything they want to, which again includes both reputable and non-reputable sites. And so just be very careful about what we take as gospel for what we type in and what we receive as a result.
One of the things I've taken from this, and I want to reiterate it for people listening, is being proactive. In other words, being prepared. Have your records, know where your vet is, know where the emergency vets are, all that kind of stuff. It's easy stuff to do. We just never think about it, because when the time happens, we start panicking, and if we're not prepared. We just don't do it as well as we could.
Absolutely. And I'll leave with one other comment, and certainly if you have other questions, happy to not leave it there. But I think the exciting thing also in this profession, and not everybody knows, obviously Mark introduced me as an emergency room board certified specialist. There are specialists in a lot of different areas that I think are surprising to many pet owners that just don't know. For the most part, you name a human specialist or specialty that you're familiar with, it exists in veterinary medicine. Some of the odd, unique subspecialties may be rolled into something else. For example, there's not truly an endocrinology field in veterinary medicine, but our internal medicine board certified specialists are the endocrinologists. But there's everything from cardiologists to dermatologists to my wife is actually a veterinary ophthalmologist, board certified, neurologists, the list goes on, radiologists, et cetera, et cetera. And so please recognize that there is a lot of opportunity out there. And I say that in 2 different ways. For you to recognize that if your pet has a problem, it may be an opportunity for you to consult a specialist. But at the same time, general practitioners, I think, are tasked with so much. I give them an incredible amount of respect because how much they need to know. They need to know basically any and everything. Be the jack of all trades, and I say that in the most positive way. They are your radiologist, your dentist, your dermatologist, your emergency room. They do it all. But I don't want you to be upset if they say, listen, I see what's going on here. And for a variety of reasons, it may be a practice limitation that we're not open 24 hours, a diagnostic limitation, I don't have ultrasound here, or even an expertise where like, I know what's going on, but I really think you need to see a neurologist. I really need to see you to see a cardiologist. We want the best thing for your pet. Now, I'm sure there are cases where it's not possible, whether it is financial, geographic, or otherwise, where you just can't do that. But I don't like when I hear that somebody is upset because their veterinarian referred them to another specialist or another doctor. What they're really trying to do is give you the best opportunity. Think about it this way. If your family member had a heart problem, would you ever second guess if your family practitioner said, I'd love you to see a cardiologist? You would never second guess that. That's the best thing that we can do for your family member. That's the same thing a veterinarian's going to do. Me as well, as an ER specialist, if I diagnose a heart problem, yes, I'd like to think I'm the best person to make sure that your pet is out of a life-threatening emergency. But once I stabilize your pet, even as a specialist, I'm going to say the best thing is for a cardiologist to do a consult. We'll do an echocardiogram, an ultrasound of the heart, and we'll take it from there. That's my best recommendation. Now, if you can't do that, I'm going to do everything in my power to give you as much information as possible and the best treatment plan I can. But I don't want you to be upset at me, nor in the other situation, your general practitioner, because it really is, in our best opinion, what we can do to give you the most optimal, best care for your pet.
Cool. So if people want to either contact you with questions or, and the other thing too, a link for Tether, for guys listening, it'll be in the description, but can you tell people now some different contact stuff that they can do, either social media or whatever you want to put out there?
Absolutely. And so I think probably the easiest thing for me to say is to give my Tether email, because it's the shortest email that I have. So the Tether website, if you want more information on that, it's Tether, Tether, tether.pet, P-E-T. And my email, if you want to reach me, is garret@tether.pet. Now, you have to blame my parents for this. They made my name as hard as it can be. It's 2 R's and 1 T, Garret. So it's garret@tether.pet, and the website is tether.pet. That's the easiest way to get in touch with me. Happy to get you any and all information related to emergency medicine, Tether, or other things that I'm involved in, but really love speaking to the community and professionals and helping any way that I can.
Okay, so now we're at that my favorite time, telling a joke. And like I tell everybody every time is, I know my jokes are bad and you cringe every time, but if you want to be on the show, if you have your kids, grandkids, nieces, nephews, or you even have ideas for the show, you can always email me at mkyle@forrealpodcast.com. But luckily today, Garret has agreed to tell the jokes. You're not stuck with me. So Garret, the comedian floor is up to you. Go for it.
Awesome. I'm going to give you 2 jokes if that's okay.
That's perfect. Great.
They're both from my 7-year-old son, Nash, and he's very excited for me to tell these jokes. So Nash, buddy, this one's for you. The first one is, what do you call a big, big pile of cats?
A big, big pile of cats.
Like bigger than a hill. A big pile of cats, bigger than a hill.
I don't know. What do you call them?
A meountain.
Oh, I like that one. A meowton. I like it. That's a good one. Nash, good job. Okay, what's the other one?
So this one is it's Nash's joke, but as I said before, my wife is a board-certified veterinary ophthalmologist, and so this will obviously have an ophthalmology theme here. What does a unicorn call the surface of its eye?
A unicorn called the surface of his eye. I have zero idea. What do they call it?
They call it the unicornia. The unicornia.
Clever. That's a
so
good
that
one
is a
too.
Nash joke and also an ophthalmology theme for my wife. And so I had to hit both ones for them because they are amazing and huge supporters, and couldn't do all of this without them.
Team Pat, I'm going to say it, Pachtinger.
Team Pachtinger. Now, technically, my wife was doctor before wife, and so her last name is Reinstein, Dr. Shelby Reinstein, but it is Team Pachtinger at home, and Nash and Shelby. So the they'll love that.
So as I close out, first off, thanks for being on the show. I really wanted to have somebody on emergency vet just for people out there. I think it's a really valuable thing. Your wealth of knowledge has been great, but I really, really appreciate you taking the time to be on the show. Thanks so much.
Oh, thank you. I love this so much. I love talking to you and pet owners. And like many veterinary professionals, we do this with a pure passion, a pure joy, pure love for what we do. And, my goal here is to, with anything I do, make pet parents and the pets as safe, happy, and healthy as they can. And so anything we can do to increase that, I love it. So, Mark, thank you for inviting me. Thank you for having me. And I truly enjoyed it.
Well, your passion carries through. And then for everybody else out there, it's been a treat for me today. But most importantly, from the bottom of my heart, thank you so much for listening. For real.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, listen via all major podcast streaming sites.